talk with Dr. Tracey Gemmell from the Indiana Regional Medical Center. Gynecology, I can't say it, Tracey, but I know what I mean. Gynecology and robotic surgery for gynecological matters as well. Good morning.
Good morning.
It's good to have you with us here this morning to talk about this very, not only innovative, but a really beneficial expansion of robotic surgery into gynecological services, and you're right there at the forefront of it. So let's visit about that today. Of course, gynecology isn't a topic of which I am well versed, but you certainly are. You've been doing it for a number of years, haven't you?
I have, actually. I've been in practice since 1998, mainly in Westmoreland County, and did obstetrics for many years, and a few years back focused only on general gynecology, yes.
And what made you want to really focus in upon robotic surgery?
Well, at first I had my doubts because I could tell that it was a bit of a learning curve, but actually probably one of the biggest advantages is that statistically they were able to show, and it pans out this way as well, that pain scores postoperatively, bleeding during surgery is less, the pain is less, people are back to work sooner. Generally, overall, there's infection rates are lower. So generally, overall, there seems to be a pretty decent advantage to the patient for sure.
We have heard for a long time now, since robotic surgery came to IRMC, how much more precise it is and how better able surgeons are to do what they do inside the body. It's not an easy maneuverability factor if you're doing more traditional surgeries, but with robotics you're able to do much more. Have you found that to be the case with gynecology?
Yeah, actually precision is key in surgery, of course, and with the wristed instruments, where basically the very end of the instrument that you're operating with is under your direct guidance, and you are able to see so much better. The optics are amazing. It's almost like you've shrunken yourself down and you're able to just get in the pelvis and do what needs to happen for the surgery to be successful. So you can see structures more easily and obviously get done what you need to get done, probably more safely overall.
And those benefits you talked about a couple of moments ago, they're a direct result of the fact that you're able to do work with more precision, and that especially includes the recovery time, does it not?
It does. Basically, when you're more precise and your technique is, where you're damaging less tissue, because there's always tissue damage in any surgery, even though it's sterile tissue damage and controlled. You have less pain thereafter and just an overall better outcome in most cases.
You have done hundreds and hundreds of gynecological robotic surgeries, so you're into it. I mean, you have been doing this and you've piled up that experience. Take me back to when you first began training in robotic surgery. Did you pick it up as quickly as you had hoped you would?
I'm not sure because I didn't know what to expect, but it definitely was daunting at first because you're slow. But certainly better to be slow and precise than, fast and imprecise. So basically it was the first, 20 to 40 cases. Basically you're slower than you are after a few hundred. But essentially it was enjoyable to learn those techniques and, refine them over time.
I want to get into women's health overall and the importance of women taking care of themselves in a couple of moments, but I want to continue with robotic surgery for just a moment and ask you, when we think about gynecological robotic surgery, are there procedures that can be done or should be done in other ways, or what surgeries can you actually do robotically?
Basically, that's kind of a tall question that you ask because there's so many different disorders and whatnot. But basically what it has done is allowed, for the most part, any open surgery, meaning an abdominal hysterectomy with a long incision and a longer recovery, the grand majority, probably 98% of those, actually could be done laparoscopically with robotic assistance. So that's the biggest turn in my career, is that many things that I was doing with an open incision, I've now been able to convert those to the laparoscopic robotic platform. And I've never had to convert any surgeries because of difficulty using the robot. Mm-hmm. So it's really a wonderful tool.
So here we are at the beginning of a brand new year, after a year that no one ever expected, and certainly no one has ever experienced. 2020 was not a lot of fun for anybody. But as we begin this new year, and we talk to women specifically, women's health has so many different components, and the gynecological component of it is very, very important. So what should women be thinking about as we enter into the new year when it comes to things that maybe they didn't do last year because of the pandemic?
Well, I think a lot of people did put off some of their basic checkups. So certainly getting back on board with basic health care, getting their PAPs on time, getting their mammograms on time, and basic screenings, that's certainly paramount. And I think, in general terms, we've all kind of fallen off the apple cart when it comes to exercise and eating right. So in general terms, I think that's part of the issue too, that we all need to have the same New Year's resolutions over again. But I think it's even more of an issue this year, with last year being so chaotic.
Yeah, and of course those screenings are so important. It's universally accepted that the earlier you find out that there's a problem, the easier it is to treat, correct?
Absolutely, and that's what I'm hoping we won't be seeing over the next year or two, are people who are playing catch-up and wish they hadn't, put things off. Although, again, some of it's been out of their control, but some people, they're still putting things off, which I think it's still safe and wise for them to keep up with their basic health care screenings.
Yeah, so it's not the time to, let's put it this way, it's not too late to start a New Year's resolution that says, I'm going to take care of my health, take care of myself here in this new year. So for ladies, when should you start your annual visits to a gynecologist? Is it an age thing that really dictates that?
Well, at the very latest, we recommend age 21. Some young women who have reproductive needs prior to that, certainly we welcome them as well. So it's around age 15 is the earliest that I see patients in general terms for whatever issues they may be having. But at the latest, age 21 is the age to get started.
Mm-hmm. And it should be annual, correct?
Yes, annual. And that's according to the American College of Obstetrics and Gynecology.
Mm-hmm. So absolutely, that is when you should make that resolution and get on board with that. And I know that you would not be averse to people badgering their family members to get it done, and saying to them, I'm doing it, you can too.
Yes, oftentimes family is our best ally.
Absolutely. Husbands, tell your wives. Wives, tell your sisters, your mothers, everybody you possibly can. And let's get this done. Let's make this a part of our real priorities in this new year. Now, you, Tracey, have had quite the journey medically, all the way going back to your days at Indiana High School. So tell me about it. What made you decide that gynecology was the field that you would like to pursue?
Well, I always liked science and biology. So at IUP, biology was my major, and really nothing else seemed to interest me. So I realized that medical school was probably the place to be. And the nicest thing about OB-GYN and gyne even in general is I feel like I can relate to many women. But past that, you have a nice combination of office and operating room in your daily grind, so to speak. Mm-hmm. And so that was sort of a aspect that I liked about it the most.
Did you have mentors or people that you really admired that you sort of used as the sounding boards to guide you through your medical education?
Yeah, there were several along the way. In a couple of the first mentors I had actually were when I was an undergrad. I spent some time here at Indiana Hospital shadowing some of the docs here. So I can recall the days when Dr. Lear was a young doc, and Dr. McCoy and some of the others that I followed around some, and they were influential for sure.
Yeah.
And then into residency, some of those attending physicians and whatnot. So it's been an interesting travel, yes.
Yeah. So You Are the One in 2021 is the name of the new program from IRMC, the 21st of each month, and you're the leadoff batter in this, so you get to take the leadoff spot. It's the 21st, which is, a week from today?
Yes.
Yeah, and this will be a Zoom event, right?
I believe so. That's what I'm told.
Okay, so what are you going to talk about?
Well, that's a great question. I have to give that some thought over the next week.
Got to figure this out, do you?
I am.
Yeah, so you'll be presenting, and then IRMC dietitian will also be a part of that program. It's at 6 p.m., and folks can go to irmc.org/you are the one. Just spell out the word one. You are the one, and you can get signed up for that. And this event and all of the subsequent events on the 21st of each month are going to be very, very important, and especially to ladies for this one, with a discussion of gynecological needs, gynecological procedures, and services that are available to you. And you're right there at the forefront of that. So you're keeping office hours here in Indiana County now?
Yes, both in Blairsville and at the IASA building right attached to IRMC, yes.
Very, very good. And I assume that, therefore, you're available through IRMC Physician Group. Let me just put it this way. How would people get in touch with you in order to make their appointments and start this good journey?
Well, there's a central scheduling line, I guess, to my understanding, and also through our main office here at Indiana, which is the 724-427-2797.
Yeah, and the IRMC Physician Group number that folks can call is 888-452-IRMC, 888-452-IRMC, put a 1 before it, and that's the toll-free number to get yourself signed up to go visit with Dr. Tracey Gemmell. You enjoying the trip here in Indiana?
Oh, yeah. So far, so good.
Yeah, of course, I say that as if you're new to Indiana. You've been doing surgeries here in Indiana and offering services for many years.
Yes. Generally speaking, it's been a while, so I'm seasoned, I suppose you could say.
Dr. Tracey Gemmell, again, next Wednesday, You Are the One in 2021. It'll be a Zoom event, 6 p.m., and ladies, you can get involved in this. Guys can, too. Obviously, men will have questions throughout 2021 about the very many different health topics. And again, to get in touch with Dr. Gemmell, make an appointment, 888-452-IRMC. And for You Are the One in 2021, it's irmc.org/you are the one. Spell out the word one. You are the one. Dr. Tracey Gemmell, thanks so much for being with us today.
Thank you very much. It's been enjoyable.
Have a great day today.
You too.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160 FM and AM 1160 FM.